So the right knee already have the surgery, and we treated the right knee before, and you change your diet to lose weight and reduce the inflammation. And so now after surgery, after all the PT and acupuncture, how do you feel this right knee?
Well, this is 8th month after the surgery, and I'm very happy with the healing. I had a good doctor, and I had Lee to help me so that when the surgery was done, I didn't have a lot of inflammation. I didn't have any swelling or water or anything. So it made the surgery go a little bit smoother. I'm on physical therapy. If they tell me to do something, regardless of the pain, I was on pain medication, I did it. So I'm 8 months after surgery, very happy with this knee. If I get the same results out of this one, I couldn't be happier.
Yeah, so right now the left knee has a lot of arthritis, and when Bob walk more, then it swells up, and also it's bone on bone. So he's gonna to have the surgery at the end of January. So we are trying to do the similar thing for the right knee. Now for the left knee, we reduce the swelling, and we try to balance the muscle so the kneecap will be in the right position. So Bob likes to do his bike and exercise to strengthen the muscle. But strengthen muscle is one side, and balance the muscle is the other thing. If you have strong muscle, but your muscle is not balanced, then the kneecap can be out of alignment.
Yeah, I could see a lot of the swelling, like a month or so ago before I started to get treating, I had a lot of swelling. If you look now, there's really not that much swelling, just a little bit here. And I do have access to a pool, so I do a lot of pool exercises. That's just pretty much to get the flow of my movement, but it doesn't do anything for strength. I have to do other exercises to build the strength up so that and this leg is pretty strong because it has to put me through the surgery